Making coffee in his kitchen brings joy to Shawn Baker. For the past 10 years, he's lived on the streets of Orange County, which for him was more dangerous than for most.
I was born with a congenital heart defect. I've had 5 open heart surgeries, been in and out of the hospital, pacemakers, and then living on the streets I got a lot sicker quicker.
Pneumonia, skin ulcers, and staph infections sent Shawn to the ER multiple times each year, compromising his heart and threatening his life. And then he was hit by a car. But what could have killed him may have ultimately saved his life, because after surgery, doctors discharged him here. Illumination Foundation, a nonprofit organization that runs a special program for people like Shawn who have nowhere to go to heal.
Homeless individuals that end up in the hospital have complex chronic medical health issues. They end up coming to our setting called Recuperative Care, which is a 24-hour facility that provides medical oversight along with comprehensive set of services to help stabilize these individuals.
Once clients stabilize, the staff works to place them into permanent housing. This effort is gaining real ground today through CalAIM, a major initiative of the state's Medi-Cal program. CalAIM funds services that address a patient's complex social needs, including housing.
Housing is health. And so Medi-Cal health plan's ability to really address that person from a holistic perspective changed dramatically in California when CalAIM became a reality. The benefit of that was we had the opportunity to build partnerships to really address the issues at the root cause.
Partnerships forged for the first time across different sectors to achieve a shared goal: moving unhoused people with chronic illness into permanent homes. In Orange County, that partnership includes Illumination Foundation, the Orange County Healthcare Agency, and CalOptima Health, the county's largest Medi-Cal managed care plan. Building trust is key.
When we got into this partnership, we had that honest conversation that we're going to get in this together. We're going to trust each other's judgment here. We talked through challenges, we talked through opportunities, but it was that trust that kept us moving forward.
Where are they in terms of housing?
The medical team, the housing navigator, the case manager, the substance use counselor, we're all going to get together and say, okay, these are the 10 clients that we know we can move through this continuum of care, and these are the things that need to happen by each discipline to get them to that next path, to move these clients into housing.
Housing secured by the Orange County Healthcare Agency, leveraging its long-term relationship with the County Housing Authority to provide government-paid rental assistance in the form of vouchers.
My role was really to bring the vouchers to the table. The partnership with the Illumination Foundation is critical because they're the ones working with the clients. They're the ones that are helping them fill out the paperwork, helping to look at units, help negotiating with landlords. You need agencies that are in different realms to make this successful. Without any one of those, it's not going to work.
It worked for Shawn Baker. After 10 years on the street, he now lives in a 1-bedroom apartment. A caseworker keeps in contact, helping Shawn build living skills and confidence, all paid through CalAIM's tenancy-sustaining services.
Do I just call them, like my utility company, and tell them that I'm disabled?
Yeah.
They don't just drop you off and say goodbye, which is good. When you haven't had like your own place or anything, there's a lot of things you could forget. So they remind you. So that helps a lot.
Today, more than 100 people with chronic illnesses are off the streets of Orange County and in homes because agencies decided to join forces. Early data show cost savings will be significant. But success can be measured in other ways.
It's a gym here in my apartment complex that I go to. From working out, my doctor said that my heart is normal now. Going through 5 open heart surgeries, it was never normal. So just living here has changed even that part of my life, which is actually a miracle.
People like to hear when things work. All that happened was two highly bureaucratic organizations decided not to be so bureaucratic and join partnership with an incredible community-based organization, use a lot of existing resources, and make something happen. It's when we work together and really bring sectors together that we can solve these larger social issues.